Dr. Abha Majumdar is one of the country's leading gynecologists. She now joins me on the line. Dr. Majumdar, it's being said that not having a law is proving detrimental because it's really a legal grey area where no one really knows what the law is. There are some ICMR guidelines that are not being followed. The question is, how important is this law? Because we've seen in several cases there are laws, but there's no implementation. Do you believe a law will really prevent practices like young girls donating their eggs for earning pocket money, ma'am?
What is very important is ICMR has set guidelines. The whole of Europe is either regulated by guidelines or they have regulations. Now it depends on the country whether they like Brussels or Belgium has regulations, whereas on the other hand there are countries like Sweden which has only guidelines, but then the clinicians have to follow guidelines. We are very lucky that ICMR has made guidelines which were made in 2005 and revised in 2008, and I'm sure all of us should be able to follow the guidelines.
No, but these guidelines, Dr. Majumdar, you're saying we should be able to follow these guidelines, but those words really ring hollow when we look at our story. Ravinder has brought out how those guidelines are being blatantly violated at every level. She's gone to clinics. Those clinics are speaking to these young girls. No one's bothering to explain any of the rules and regulations, and guidelines are not even being mentioned. So what action should be taken against these clinics? Should they be shut down, ma'am?
I'm sure, Rahul, that these are anecdotal instances where you have got into clinics where such donations take place. Ours is a big hospital where we do almost 75 to 80 IVFs per month, and we do not have more than maybe 5 or 6 donation cases agreed. But then they are all donors who are of eligible age and who fit into the guideline framework. That is that their age is between 21 to 35. We normally only accept married women, and we need to tell these girls that they lose their virginity in the process of picking up eggs. And hence, if we have guidelines and we can explain all these to girls, then I'm sure that most of the clinics do not have such young girls walking to them. There must be some very few clinics.
Dr. Purnima Advani,
I'm sure there are only very few clinics.
We've seen Abha Majumdar say that this is limited to a few clinics. The entire industry should not be blamed. They're following the guidelines. They're only inviting married women. Do you buy that argument, Dr. Advani?
No, I do not. These guidelines are mere guidelines and lack statutory force. Unless there is a law in place and that law is strictly implemented, nothing is going to happen. These fertility clinics are aiding and abetting. They are the main accused. They are the persons who are in fact promoting all these illegal activities. These girls are just being encouraged, because if a young girl is given a large amount of cash at the end of the process, she's just giving up her virginity, her uterus, her picking up the ovaries, which is totally damaging and detrimental to the health. I would recommend two things to be done immediately. I think the Parliamentary Committee on Empowerment of Women, which is in place, needs to take this up as a one-point agenda and to consult experts in the field before mooting a law. That's point one. I also am of the view that the Department of Human Resource Development should include education on the ill effects of oocyte stimulation in their curriculum, so that young girls know what is the flip side of it, what is the negative side of it. This is extremely important, and for the government not to pay attention would be a gross omission by which the health of young girls would be suffering.
That's a very, very important point you're raising, that the level of education needs to be raised so that young girls do not look at egg donation as a way of earning pocket money. They realize fully the medical risks involved in this. For the moment, Dr. Purnima Advani, Dr. Abha Majumdar, thank you very much for joining us, and thanks most of all to Ravinder Baba for having put this story together, and really an eye-opening account of how young girls are falling prey to the lure of money at these fertility clinics.